seeing you in the video.
All right, we are live on YouTube.
Good morning. We're convening at 10:36 a.m. We'll begin the meeting with an invocation, which I will do, followed by the Pledge of Allegiance, which Jim Curran will do, and then we'll do the roll call and minutes and head on into the agenda. So please join me if you wish for the invitation. Heavenly Father, thank you for allowing us to gather today under these challenging circumstances, which we know we will work through together. Thank you also for the recent celebration of Easter and its symbolic regeneration of life. Spring speaks to that as well. All of us can think of recent losses in the Berrien County family and some of us in our own families, but we rest with the assurance that our departed loved ones are fully restored and will be there to greet us when our times come. Give us guidance today as we go forward with the business of the county. We ask this in the name of Jesus Christ. Amen.
Amen. Please join us in the pledge of. I pledge allegiance
to the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Thank you, Jim. Will the clerk please call the roll?
Elliott.
Here.
Yarborough.
Present.
Harrison.
Present.
Hinkleman. Scott.
here.
Curran.
Here.
Meeks.
Here.
Hugo.
Here.
Majeric.
Here.
Chickering.
Can see him.
He's there. Chickering. I unmuted him. Bill Chickering.
Bill Chickering and say, okay.
He's here? Yeah. Ball Wrap.
I'm in attendance.
Freeling.
Present.
Mr. Chair, you have 11 present. Hinkleman is on there.
Yeah,
Oh, Hinkleman? Are you
Here.
there? Okay, 12 present.
Thank you. The minutes from the 23rd of April have been emailed. Are there any changes to those minutes? Hearing none, is there a motion to approve the minutes as prepared by the clerk?
I'll make that motion, Michael Majeric.
Commissioner Meeks,
Thank you.
second.
Moved by Majeric, supported by Meeks. Roll call, please.
Lay down.
Yarborough.
Yes.
Harrison.
Yes.
Hinkleman. Hinkleman. Do we have Hinkleman on line?
He's muted, and so is Meeks. They're both muted.
There he is. John's on me.
We need
Yes. Can you hear me?
to- Now we can hear you.
You got it, there you go.
Scott
Yes.
Chickering. Chickering, I see you.
He said yes, we just can't hear him.
He's muted.
Ball Wrap.
Yes.
Freeling.
Yes.
Curran.
Yes.
I can't hear anything. Are you talking, Annette?
It looks like Annette muted everybody.
Yeah, the large conference room is muted right now,
Okay.
the Board of Commissioners room. So if that gets unmuted, Annette, then it will work.
I'm sorry, I muted the large conference room. Now you're good.
Okay, Hugo,
Yes.
Majerick,
Yes.
Meeks. Meeks. Is Meeks there?
Yeah. Have to read lips.
Can anybody see? I can't see that.
Yeah, he's saying,
There he is.
Is he on? Meeks, you're gonna have to sign.
Yeah.
Can I just get the thumbs up?
yeah,
Elliot,
yes.
Mr. Chair, you have 12 yeas.
What
Thank
are
you.
we vote? What are we voting on?
Minutes,
Okay,
Minutes.
already vote. I couldn't hear you for a while.
Sorry, I accidentally muted the conference room. I didn't mean to.
Technical difficulties.
Thank you.
Okay, so the minutes are approved unanimously. Madam Clerk, I know we have communications.
yes, you should have received 7 emails. I sent one to you today also. Sarah Collins, Watervliet, an email disapproving the board's letter to Governor Whitmer received on April 24th. Nancy Buckleitner, St. Joe, an email disapproving the board letter to Governor Whitmer received on April 24th. Livingston County Board of Commissioners, a resolution support stepping up the initiative to reduce the number of people with mental illness in jails received on April 24th. Marilyn Bailey, Cologne, an email supporting the board's letter to Governor Whitmer received on April 24th. Adam Rochefort, St. Joe, an email supporting the board's letter to Governor Whitmer received on April 25th. Adam Rochefort, St. Joe, an email with a resolution attached to move Michigan forward received on April 28th. Don Richardson's, Berrien Springs, an email thanking the board for the letter last week to Governor Whitmer and a resolution attached to move Michigan forward received on April 29th. That's all.
Thank you. We're going to have a presentation by Dan Fetty and by Nikki Britton. Dan is here in the room. Nikki's on the TV screen. Hopefully everybody's going to be able to hear everybody. If not, wave your hands or do something to signal that you're not getting audio.
Show up and speak.
And then we'll know what to do, hopefully. So, who wants to go first?
Nikki's
Yes.
slides are first. So
Nikki,
we'll start.
in your coverage, can you include the matters that we went over on Monday, referencing new cases, how many people have been hospitalized, how many have been put in ICU from those that have been hospitalized, how many who have gone into ICU have needed to be on a ventilator, and how many people have recovered just in the course of weathering the virus and then getting through it. So with that, we'll look forward to having your report. Hopefully everyone can hear you. Again, if you can't hear Nikki, speak up or signal or something. Okay, Nikki?
All right, thank you for that. I'm glad to be able to be back, show you a little bit more information. I have a bit of data that we're going to walk through talking about just the situation with COVID-19, where we're at, and then start transitioning into what we're watching for as we enter into a phase of gradual reopening. So next slide. So these are our numbers for as of the yesterday afternoon, the latest update. So that's 242 confirmed cases, 169 presumed cases. These presumed cases are ones that have all the symptoms of COVID-19, but they have not been tested. Plus, they have a link to a confirmed case. We have identified the majority of those presumed cases through contact tracing of the confirmed cases. We're at 15 deaths, and we do have 171 people who have recovered. We are really most able to track recovery on people who have been a confirmed case in the first place. So that's where we stand right now. In the state of Michigan yesterday, we did surpass 40,000 with about 3,600 deaths. Next slide. So this graph shows the onset date, the number of people who had their symptoms. So there's 411, I believe, confirmed and probable cases combined. This graph does show how many people had their symptoms begin on any given day. So when we do case investigations, we go back and ask people when their symptoms started. You can see that there was a little bit of an upward trend in those in the number of people symptomatic there in mid-March. And from there's been a little bit of variability. We do expect there to be variability when we have smaller numbers on some of our peak days of symptom onset. We've had about 16 people, again, amongst the cases that we know about and have been reported to the health department. It's a little bit tricky with this amount of numbers for this period of time to have a set trend. We also know that when you're looking at that last week of data, there could be people who have had symptom onset in those dates that have not yet tested positive or have not yet been reported to us. So the numbers there at the most recent dates, we could see an increase in that trend. The next slide does show some hospitalization data. This comes from Spectrum Health Lakeland's website. This data is available. The top line there with hospitalized patients shows what's currently happening in the hospital. So this was a snapshot yesterday. There were nine people who were in the hospital but not in the ICU who were COVID positive, 3 who were in the ICU and COVID positive. And then the middle line there does show just general hospitalization use, and it's not referring, these are people who are not hospitalized for COVID-19. These are indicators that are being tracked just for surge capacity so that we understand where the hospital's at. As you can see, utilization is well below what surge would be and reflects what we're seeing in the community. And then that bottom row there does reflect the testing that Spectrum Health Lakeland has done in the previous 24 hours, as well as those cumulative numbers. We do estimate that there have been approximately 2,300 tests done in Berrien County. You can see Spectrum Health Lakeland has a cumulative number of 1,962 tests. Intercare has also been doing testing for much of the month of April. I don't have their exact figures on how many tests they have done, but we estimate that it's been at least a few hundred. So there's a fair amount of testing that has happened here in Berrien County. Next slide. So this is a map showing some of the geographic distribution of where we're seeing our confirmed and presumed cases in Berrien County. This map, again, it only captures illnesses reported to the health department. We know there are other people that have been ill and it's never risen to the level of being tested or being reported to the health department. And the map is based on somebody's home address. But as we all know, people do not live the course of their entire lives in one zip code, especially or even under a stay-home order. There are people that continue to go to work or the grocery store or get gas or pick up food in a restaurant anywhere. So it's important when looking at this map, this isn't necessarily showing this is where I'm at most risk, or conversely, I have less risk if I'm in certain zip codes. It really just is an indication of the residents where people are who have been tested or presumed positive. Next slide. So we do have a dashboard coming soon. I'm going to try to see if I can share my screen because the dashboard did go live this morning. I would need Annette for you to stop sharing your screen in order for me to share mine. Okay. So this is a dashboard that we currently have live on the county's website. When you first go to it, it has these 6 panels here. We do have right now 411 combined of the confirmed and presumed cases, 171 recovered, and 15 deaths. If you look in each of these tiles too, there's also a place where you can click on the tab. So we can break down what's going on or who is represented in this 411 by gender. So about 55% female versus 44% male. When we look at race and ethnicity, we do have 36% non-Hispanic Black, 51% non-Hispanic white, 9% Hispanic or Latino, and then we do have some other races represented with some smaller percentages here as well. And then we've also got the age breakdown. So we actually see our highest numbers of presumed and confirmed cases in that 60 to 69 age category, as well as 30 to 39. The graph is skewing a little bit here to the left, but we do have presumed cases in there, and there are a lot of people who might be a confirmed case that have children living in their home, and those are some of the contacts that are there. But this represents the distribution of age for people that have that confirmed test or symptoms and contact with confirmed person. When we look at recovered, yes.
Quick question on the graph. Are we able to discern from that graphing or from other data how many people under 60 have required hospitalization?
Yes, and that's not represented on this dashboard. We do have that figure, and if I look at my notes here real quick, you're saying under the age of 60?
Right.
It looks like there's been about 10 out of 59.
Okay, thank you.
Same thing, you can look at the different tabs. I won't walk through all of these tiles because that's something you can walk through. This tile here right now does have hospitalization data. It does talk about current census that's updated once a day. And then here we have a couple of different graphs. So this is the graph that's what I just showed you. That's got the epi curve of the number of cases per day. We also have this graph that shows cumulative cases. So this line is always going to go up because it's tracking what is our grand total of confirmed cases. So if you're looking for that typical epi curve that goes up and then goes down, this graph is not it. This is actually that graph. There's just a lot of variation when we have smaller numbers. And there's also a map here that's interactive that you can zoom in on and take a look at that shows that geographic breakdown similar to what I just showed in the presentation. So I'm going to go ahead and stop sharing my screen so we can get back to the PowerPoint that Annette was sharing. And while she's pulling that up, so I've been showing you, we've walked through some of the data. There's a lot of other data points that we have that we're continuing to monitor. And we are continuing to do our case investigation, our contact tracing. That remains incredibly important. And really in identifying what's going on, that contact tracing and case investigation will continue to be a really important strategy as things start to open up. There's going to be just more mixing of people. People will have more contact with one another. We're obviously businesses are planning to have safeguards in place to try to minimize the risk with those contacts, but contact tracing and investigation, when there are positives, will continue to be really important. Life after the stay home, stay safe order, whenever that is lifted, and how that is listed, there are recommendations from local public health that, and Annette, I don't know, are you able to get the slides back up?
I'm trying.
Okay, I'll keep talking, no problem.
All right.
So some of the things that we are watching in public health to monitor, is it time to be reopening? And as we're reopening, how is transmission going? Where are we at? And are there some of those dials that need to be tweaked? I have really been thinking about reopening as a series of dials that gets tweaked as to, we can turn this on, we need to scale this back, maybe turn this up a little bit more. And I think we're on slide 8, Annette.
Yeah, you're right. You got it.
So some of the things that we are paying attention to in public health, we want to see a decreasing number of new positive cases each day. We want to see a downward trajectory of the total number of cases, or the percent of cases of tests, that come back positive. See a decreasing number of hospital admissions, of ICU admissions. We want to see a decreasing number of deaths. So those are the data points we're monitoring. For the most part, I wouldn't say we're seeing a decreasing trend on any of these, but we're seeing a flat trend. Some of these never really took off into that really steep increase because the social distancing measures took place so early in disease transmission here in Berrien County. So there's definitely a flattening of these, but these are things we're going to continue to pay attention to. That decreasing number of new positive cases for each day will require a lot of context to pay attention to, because if we do more testing, we will find more positive cases. The other things that are there is we want to make sure that the hospitals can treat patients without crisis standards of care. We're absolutely meeting that criteria right now. The ability to test all people with symptoms for COVID-19 is not something we have in place, although in our community, we are looking a lot better and have more testing supplies and capacity than many other counties. The health department does currently have the ability to conduct robust case investigations and contact tracing. However, as we start to assume more of our routine services in the coming weeks and months, we are going to have to think through what is that plan and may need additional resources to continue doing that well. And then obviously workplaces having the ability to follow the safety guidance put in place. And I think those recommendations are still forthcoming. So those are some of the major things that public health is looking for so that we can reopen things safely. Next slide. So I've talked through a lot of these different things, and I think Dan is going to get there, but there's going to be a lot of things that workplaces and organizations are going to need to consider as they're starting to plan for reopening. There's risk factors within all of the different businesses. It looks different depending on how you operate, as well as some of the characteristics of just individuals, of the employees, and then whatever monitoring might look like, and then potential reporting of symptomatic employees to the health department. So I think this would be a good time to maybe pass it over to Dan.
Before we do, since people might have a question now and may forget it later, anybody have any questions about the report or about any of the narrative that Nikki has provided this morning, which has been very helpful?
Nikki, this is Commissioner Ballrath.
Mm-hmm.
If we had to, back on slide 8, where it says the hospital's ability to handle things without emergency, turning to emergency, if we had to turn to those emergency care, how are we set up for that? Pretty good, I'm assuming.
So I don't want to speak exactly for the hospital on operations and exactly how they would handle this, but in the planning that we've done in partnership over the last couple of months, our Spectrum Health Lakeland does have really great surge capacity, and we're also in a somewhat fortunate period of time that they almost have double ICU rooms because the new pavilion was able to open in early April, and that had a whole new set of ICUs, and the other ICU is still intact and used. So for a community our size, we actually have a lot of ICU rooms. We have better capacity. Right now, especially with volumes of just other care, whether it be elective surgeries or other things, the volumes are somewhat low across the country in healthcare systems. So we are nowhere near close to resorting to some of those crisis standards of care. And I'm confident that Spectrum Health Lakeland has a really strong surge capacity.
I do too. Thank you.
Nikki, a couple questions. Can you hear me?
Yes.
Nikki, first of all, the average age of death in Berrien County is what?
I don't know if I have that in terms of average age. I'll have to get that back to you. I think all of our deaths have happened in people above the age of 60.
Okay. Secondly, for antibody testing, I never hear anything about that. How much longer is it going to take before what I'm hearing is I'm hearing advertising even done on television that says that if you believe you've had this and you can have antibody testing, you can help with your blood. And how far are we away from testing for antibodies for this to find out how much of the population has truly had this?
So antibody testing is complicated. In terms of how far away from having any antibody tests locally, I'm not 100% sure. I think that's something that within the next month or so, I've heard that Spectrum Health might have in place. Please don't quote me on that. I'm not 100% sure. The issue with antibody testing is it can be used multiple ways. So trying to do antibody testing on somebody who has been ill to determine their antibody level for, say, the use of convalescent plasma to try to give that to somebody else, that is in place and happening a little bit throughout the country and in different places in the state to try to determine if we can use convalescent plasma. In terms of an antibody test to see how much of the public has been ill and what levels of immunity might be out there, that is pretty problematic with any of the tests that are currently on the market. The FDA approval is coming on some of these products, but not everything that's out there has approval. And a lot of things that have been undergoing testing are just not accurate. And then we also have the issue of we might be able to detect antibodies in somebody. We don't have enough research or knowledge of what antibody level do you need for it to be an actual protective immunity. So I know there are some states that are talking about this idea of an immunity passport or something to do population-wide testing of antibodies to know who can report back to work safely and is immune and who can't. That's just not really a reflection of the capabilities of the testing available right now. And the Michigan Association of Preventive Medicine and Public Health Physicians has issued some cautions to the state, to the governor's office about trying to use antibody testing as any sort of strategy for getting back to work. It might be a small one tool among many that could help in certain sectors. It could really help with some of our critical healthcare infrastructure to know, okay, we know for sure, we know that this person, this healthcare worker has been exposed and has antibodies. They might be a good person to be treating COVID patients. But in terms of mass application in the population, we're a ways from that as an option.
That's disappointing because it would seem to me that it would be paramount to try to find out how far this has been through the population already, and it would seem really critical. Even if you set aside the getting back to work portion of this would seem to be something that would be a tremendous calm to people. They knew that how much of it had been through the population already. And the question, of course, I would have is why are they advertising for it on television if it's not something? You mentioned that it was the Michigan people that came forward and said it wasn't perhaps a good way to ferret out solutions, but apparently other states are thinking differently about this.
I have heard in the national media that there have been other governors who have put that forward. I'm not sure what their public health infrastructure in those other states is actually doing in operations. I'm not 100% sure. And I do know that anybody could create a product with some amount of claim and bring that to market, and that's very confusing for consumers. I agree with you that information would be wildly important, and if we actually knew that, it would aid decision making. We're not at a point where we can garner that piece of information of understanding what percentage of people have actually been infected and have a level of immunity.
Thank you.
Most of you, unfortunately, aren't privy to the briefings that we're doing several times a week with EOC, we had a meeting Monday afternoon out at the EOC facility. Dave was there, Jim was there, Bob was there, I was there, Nikki, the sheriff, Captain Adams, and some other folks. And I'd like to go over a couple of those items just for the benefit of the full board and get your comments, Nikki. One of them was from Dr. J about the standards applying to high-density population areas, and then what standards should apply elsewhere. Now, our high population density area primarily is the southeast part of the state, and I understand the governor is now considering a regional approach as we reopen. Do you have any more information about that?
I do not have any more information. I know that the, excuse me, I know that that's being considered. I do think that a regional approach would make some sense, because as a state with as many square miles and population that we have, it's obviously going to, everyone's experience is going to look a little different in different corners of the state. So having a little bit more tailored approach in different parts of the state makes some sense. I would be very curious how we would operationalize that type of regional approach, and if that's something that the state would dictate by region, or if that's something that locals in the region would be tasked with determining.
Okay. We also talked about the rationale for extending the local declaration of emergency into May. Right now, I think it's set up for the end of May, with the understanding we could cut it back sooner if circumstances warranted. And to avoid sending mixed messages, since our data is better than the national data and much better than the data for the state, can you touch on what we talked about Monday about the need to continue the civil immunity protection that we get under the declaration? And I think Rocky talked about it gives us continued access to FEMA money. He's not here, but could you address both of those for the benefit of the board?
Sure. So, and I don't want to get too far out of my swim lane here, because that's not my area of expertise on the declarations, but it's my understanding that the state of emergency declaration here in Berrien County does extend some of the liability protections if we have people who are not county employees, but are contributing to the county's response as if they were county employees. It extends a little bit of the liability protection. At the health department, we are utilizing some members of Spectrum Health Lakeland staff to contribute to our specific response. And I know that there's that type of coordination and collaboration that's happening in other sectors of the county. If we do extend the state of emergency, that would be more a reflection of the resources that we need to continue to have an adequate response, and less of a statement that it's never been a statement of how dire things are out in the community or how much risk there is of disease transmission or death. That remains pretty static. And you've seen the data we're maintaining. There's nothing different today versus tomorrow, but maintaining those liability protections would be really valuable. We do also want to make sure that we can stay eligible for any type of FEMA reimbursement that might be required. We do have on standby some isolation and quarantine facilities that we have had approval for potential reimbursement from FEMA should we need to use them. And being able to stay in that state of emergency, providing some of the access to those resources seems like a really smart move to me.
Okay, thanks. One other question just from your presentation. With our testing increasing, should we expect that we're going to see on that one graph where it showed the line going up, should we expect we'll see an increasing number of positives, but not necessarily a parallel increase in the number of hospitalizations, particularly ICU admissions and things like that?
So if we're seeing an increase in the number of confirmed cases because we're doing better testing and just finding more of the cases than we have been, I would expect to not see a similar increase in the hospitalizations and ICU admissions. If we do start to see the hospitalizations and the ICU admissions go up at the same time, that's indicative that we have more transmission happening, and they're all going up together.
Okay. That's all I can remember from Monday. Was there anything else, Nikki, you can think of that we should share with the whole board today?
I think just the understanding, and Dan's going to get into this as well, but what we're doing as a county to work with our other economic development and how we're trying to approach reopening so that we can both alleviate the pressure on the economy, because we know that has health ramifications as well, while keeping in mind infectious disease transmission.
Okay. Based on those additional comments, does anybody else have any questions before we shift over to Dan?
Thank you,
All
Nick.
right. Thanks,
Thank you.
Nikki. Have a good rest of the day.
Thank you.
Thanks, Nikki.
Thank you so much.
Dan, I forgot you were there Monday. I apologize.
Well, I was wearing a face mask.
Well, that's right. I didn't see your face.
Ask Brandon.
And then can you kind of expand that into like the slide view? So I can read
Well, I was trying to do that,
it?
but
If not, don't, I guess, let's not risk screwing up.
losing it, yeah, sorry.
All right,
Is it this slide or do you need to be in the next one?
next one.
Next one.
There we go. Okay, so I will give a presentation that's gonna be much briefer than Nikki's, but what I'm gonna talk about a little bit is where we are, at least where we think we are in terms of our current economic situation. That it's hard to gauge, but we can make some guesses at it. I'm gonna talk a little bit about Michigan's guidance and recommendations moving forward for the reopening of the economy. You know, just to skip ahead, I'll tell you, these are very broad guidances at this point. They've not been boiled down to anything really concrete. Talk a little bit about the assumption that reopening the economy is going to be a phased approach, kind of industry sector by sector, and not some total, you know, one day we all go back to work as things were before. And then finally, I'll mention a little bit of the coordination that we're engaged in with our local nonprofit partners, as well as some private sector businesses that are working on their own reopening plans. So with that, next slide, please. There we go. Oh boy, I can barely read this. That's okay. So I think the first thing, kind of to conceptually understand what's going on in the economy, this is not anything like we experienced during the Great Recession, where there was just a complete drop-off in spending and demand, and as a consequence, you know, jobs were lost, household savings were impaired, corporate equity, corporate earnings declined. That's kind of what we experienced in 2008, 2009, was kind of a standard textbook recession, although it was a very severe one. In the current situation, I mean, essentially what we've done is just like slam down the brakes intentionally to more or less put us into a recession. But at the same time, the productive capacity of the state's economy still exists. The productive capacity of our local economy still exists. You know, there's still all the capital assets. There's largely the same amount of business equity that existed back in March. Household wealth still largely exists as it did back in March. You know, that could change and probably will change if this recession continues. But job skills, educational levels, work experience, none of that's been diminished. It's just right now, no one can actually go to work to produce anything. So this is fundamentally a problem on the supply side of the economy, which means that it doesn't respond to certain typical government measures. Normally in a demand-driven recession, what you do is you cut interest rates, you engage in stimulus spending, these kind of things that we all lived through before. That is completely ineffective in this current situation because we simply can't produce. No one can actually supply services or goods because no one can go to work safely. Now, the good news is that, at least in theory, the recovery of the local economy should be easier to manage than the recovery of, say, the Great Recession, because all we have to do is find a way to put people safely back in their jobs. And once that happens, underlying demand for goods and services still exists throughout the community, and that'll begin generating economic activity, and the engine of the economy will start turning over. And I mean, anecdotally, you can see that already. Garden supply centers, there was overwhelming pressure to reopen garden supply centers. Well, that pressure was coming from consumers who wanted to go to the garden supply centers. So we know that there is a level of underlying aggregate demand that still exists in our economy. It'll continue to exist so long as this doesn't last too long. But if we can phase people back into their jobs, that in itself will likely cause the economy to just return to prior levels. And the economists at the University of Michigan, who do a lot of the forecasting for the state and local governments, have put out a forecast where they expect the second and third quarter GDP of the state to drop precipitously, maybe as much as 25 to 30%. And then by fourth quarter of this year, it'll start to recover. And the expectation is that by the first and second quarters of next year, our economy will essentially return to the levels that it was before. So that is the good news, that this should be a recovery that should be easier for us to manage and get moving forward. But the problem, of course, is how do you put people back safely in their workplace? And it's a struggle that we're talking about here, and I think every large employer, every business is considering this. The governor is proposing something they call the Michigan Safe Start Plan. Okay, and this is a broad outline of how to reopen the economy. It'll take into account the various sectors of the economy, the geographic and workplace risks. That's what we were just talking about, kind of a regionalized approach. We're going to look at what's going on region by region, what kind of risks exist within the typical workplace environments of those regions, as well as the public health and workplace protocols that can be implemented to mitigate those risks. It'll be an incremental process, that's what we're being told, and the health professionals are suggesting that's the way to go, and it does seem to make sense. Starting, obviously, with reopening those workplaces that pose the lowest risk of disease transmission. You know, this is an outdated slide. I wrote it yesterday, but we were hearing as early as Monday that the construction sector is going to be reopened shortly, and of course that was just announced yesterday after I gave the slides to Annette. Likely, businesses that conduct most of their work outside will be reopened. That's already happened with landscaping businesses. You'll probably see more of this with other type of outdoor activities. And then the final phase will be, well, not quite the final phase, but the most important phase probably will be how do we reopen industrial production and manufacturing as well as office employment. That is important to us here in Berrien County because even though our industrial production has not really closed down, we think there's about, out of the 302 manufacturers in Berrien County, we believe there's about 19 of them that have experienced layoffs, but most of them have been able to remain somewhat open and somewhat producing. That's critical to us because it represents 28% of the gross product of the community, and about 35% of all personal income comes from our manufacturing sector. So it's a huge component of our economy, and we need to see it return to full employment as soon as possible. As far as office work, which we generally are a wide category of office work, our expectation is that remote working is going to remain a characteristic for the foreseeable future. And I think that every office employer is probably going to encourage their employees who can reasonably work from home or remotely. They will be encouraged or required to do so. And that probably will be with us for quite some time. Next slide, please. There we go. Okay. So what you see here is just kind of the conceptual framework that the governor's office is putting together on how to think about which businesses to reopen and the process by which they would reopen. And what you see is kind of a graph showing the pandemic risk vertically and then the workplace risk horizontally. So obviously what we're looking at is, workplace risks that are high in nature under an urgent pandemic risk. Only critical industries are allowed to be reopened. And that's basically where we are right now. As the workplace risk can be mitigated, so moving left to right across this matrix, as you can put into place measures to mitigate workplace risk. and as we see that the pandemic risk is beginning to stabilize, then you can look at some reopening certain non-critical industries. And this is kind of what we talked about in the previous slide. I mean, the businesses where you can have protective measures in place, where you can have separation of employees, where you can encourage remote employment. You know, those are the areas where you can start to lower the workplace risk. Obviously, outdoor activities, as we're finding out, are low risk as well. And finally, what will happen is we will move fully to the right side of this matrix, and we will see, you know, businesses that have very low risk under a stabilized or recovery pandemic environment will be able to reopen. So this is conceptually how they're looking at the problem, and it's the way that we're looking at it with our local partners as well. Next slide. So the other thing, in order to make this conceptual framework reasonable or workable, we have to actually look at the classifications of workplaces and labor force in Michigan. And these are the broad classifications that everyone's using. Obviously, you can dig deeper into these, but it kind of represents, broadly speaking, what goes on in any economy. We have office employment, industrial employment, healthcare employment, retail, restaurants and lodging, schools, construction, outdoor activities, and then kind of this catch-all for other that really doesn't fit into any category very well. Now, in the state of Michigan, what you see is about 30%, 29-30% of our labor force is engaged in office work, 19% in industrial. Healthcare is high, no surprise there. And then, of course, we have retail, restaurant, and lodging. These are the two sectors that have probably been hit. Well, not probably, but certainly been hit the hardest of any sectors of the economy. And in the case of the state of Michigan, it represents about 20% of the labor force. And most of these people are not working right now. Almost all of the unemployment claims that we've seen come from these sections. Berrien County's classifications are slightly different, or at least our distribution across classifications are different. Next slide.
Oh, sorry.
There we go. What you see in Berrien County is that we're a heavy industrial economy. We still are. A lot of people, we talk about this repeatedly in other contexts, that people think that we're a tourist economy, but if you really look at the distribution of our workforce and the gross domestic product, industry is driving, manufacturing industry. So we have 20% of our workforce in industrial manufacturing, about 19% office work, 11% healthcare. Retail is about 10%, restaurant and lodgings, about 9%, construction, schools, and so on and so forth. So when we talk about having to reopen the economy and prioritizing how that works, not only do we have to look at the workplace risk, but we also have to look at those elements of our economy that need to get back to somewhat full employment as soon as possible, because they represent such a sizable proportion.
Dan, can you tell me where ag is in that portfolio?
Yeah, John, agriculture is counted differently in the labor statistics. So what you look at is employment statistics, non-ag, and employment statistics ag. Agricultural employment right now is about 2,200 jobs, but that is, of course, seasonally adjusted across the year. But those are not included in the numbers I just showed you.
All right. I didn't know, because we were never classified non-essential, and so I didn't know if it was even included in any of the statistics, because we never stopped working.
Yeah, well, they're included in the labor statistics that are published, but they're included as an entirely separate category. Okay.
Right. That's good.
Okay. So distilling this down a little bit more, this is again coming from the governor's office as the preliminary guidance that we're looking at. What are the best practices that can be implemented within the 9 workplace types? And what you see is it breaks down to access control, social distancing, sanitation, hygiene, protective equipment for employees and people coming into the employees' contact, and then of course contact tracing and isolation of individuals or employees that unfortunately become sick. These are essentially the same things we do here in the county building right now, and it's a plan that anyone who has a large facility with people coming in and out will have to look at these basic control systems. Again, I mean, you can read through this, and I mean, these are very broad categories, and they're very common sense categories. I would say there's not a lot of technical detail in this. But we will have to do things like mandatory symptom diaries, which we already do in this building, for example. On-site temperature checks are probably going to be a best practice. Rapid diagnostic testing, if that's available, although we all know that's a problem. Intake procedures for visitors to limit visitors' access to certain areas of the facility, whether it's a public or private facility, guidelines for delivery and so forth. You can read through these on your own, but what you can see there is these are kind of the practices that most employers who have remained open have already had to put in place, and this will be a continuation of those practices. Next slide, please. All right, so what you've seen is just some really broad guidelines. Now, we are expecting the state within the next week or so to provide us with much more specific guidance. I know that there are a number of university departments as well as Michigan business organizations that are starting to craft very specific guidance based on workplace type, based on region, and based on pandemic risk within a region. The expectation is that that's all going to be pulled together by the governor's office and then disseminated to local economic development agencies as a more complete guidance of how businesses are to reopen. In the meantime, so we're, in a sense, we're waiting for that, but we're not just sitting around doing nothing. So in the meantime, Barron County Health Department, our department here, Connexus, Cornerstone, and the regional chamber are starting to work on developing our own specific guidances. These wouldn't be a substitute for what the state is going to propose, but would be supplemental to the state's proposals. In doing so, we know that there are a number of large employers in Berrien County who have already put together their reopening plans. I've seen a handful of them. And what we're going to try to do is put together a consistent single Berrien County reopening guidance document that incorporates the recommendations from some of our larger employers as well as the guidance coming from the state of Michigan. The idea is we want to make sure that we send out a single message so there's no confusion here about what employers are going to have to do for mitigation safety purposes. And at the same time, we want to make sure that major employers who have already started doing this stuff can share that material with us because they're in some ways in a better position to actually determine what's best for their own businesses. So that's where we stand right now. There's going to be a lot more coming out in the next 2 weeks as we expect certain segments of the economy will start to gradually reopen. Okay?
Questions for Dan?
Okay.
Dan, you got one up there. Yes, is that Carrie?
Yes,
Remain.
this is Commissioner Freeman. So on slide 13, there was mention with regards to the best practices. Initially in this introduction of phasing in that it would be a certified process. Can you explain a little bit on that? Has there been guidance from the state on that? What that means?
Yeah, I'm sorry. Can you repeat that, Terry? I couldn't hear you. Can you repeat that?
What I stated, sure. On slide 13, you stated that those best practices initially as we're phasing in would be certified. Has the state given guidance on what that would be, how that would look for certification?
No, and maybe certification is too strong a word. They are going to prepare all the guidances. Now, keep in mind that there's no way the government is not going to dictate under penalty of, fine, how businesses are going to do this. What they're trying to do is put together a uniform and consistent statement that spells out in very detailed practices what they're going to do. They will give that to us at the local level. The local health departments and the local health officials will comment on that to make sure it's consistent with our own emergency response plans. And then that'll be disseminated to businesses. But I think the key thing to understand is we don't envision a situation where any government is going to go in and take punitive measures against a business that is failing to follow these guidances, okay? The hope is that they will all be encouraged to do so, and out of a concern for their own customers and workers, they will do so. Okay?
Any other questions? Anyone else? Dan, can you share any insights about the extent to which we have been privy to the methodology or the data set that is being used by Lansing to tell us how we're supposed to proceed?
Well, much like what our public health officers will tell you too, it's a little bit of a mystery to us as to what the state is looking at right now. We have all the basic raw economic data that they have, but we don't know the methodology of how they're interpreting that data or prioritizing it. I mean, from our perspective, Mac, I mean, I think our local perspective, what we should be thinking about are what are the major components of the GDP of this community. Because the sooner that those major components can get back to full employment, the sooner there will be an economic recovery. But I don't know that that's the way the state is prioritizing things.
Yeah, that makes it problematic, particularly if we continue modeling based on a high population density scenario, which only applies to about 8 of the 83 counties in the state. And I'm hopeful that reason will prevail and that we'll be given some flexibility so that we can tailor our reopening to our circumstances. But thus far, we haven't seen anything to indicate that is forthcoming.
Well, yeah, that is true. Of course, there is this general statement that the state is considering a regional approach to this reopening, but we don't know, like I said, we don't know what that looks like right now. So,
one of the useful pieces of information that we went through on Monday afternoon was the incident rate per 100,000 individuals, which Captain Adams covered. And he mentioned that the state of Michigan is around 400 per 100,000. Nationally, it's around 300 per 100,000. Berrien County is around 150 per 100,000. So we've been fortunate that as we ramped up to face a major health crisis, we were ready for it, and we didn't find that we ran out of hospital beds, didn't have to make arrangements to use space elsewhere to house patients. I think the ventilator use right now through Spectrum is 18% of capacity. They have ICU capacity. I think half of their beds are open right now in the hospital. The ERs are fairly quiet these days. If you went to the ER, you'd get right in. So we've really been lucky, and I appreciate everything that's been done by Spectrum and by our health department to be proactive in this process. I just hope that Lansing appreciates that we've been proactive and that we're showing across the board an ability to handle things responsibly. And speaking of Rocky, there he is. And I guess we'll find out in the next few days whether that's going to be an option for us. But appreciate everything you're doing as well.
Thank you. I mean, as I said, we're not waiting around for guidance. We're hopeful to get it. But Nikki and Rob Cleveland and Todd Gustafson kind of meet Monday morning to start working out our own local guidance here.
Good.
Okay.
Questions now from anyone?
Mr. Chairman, I'd just like to point out that the dashboard was done by our own GIS department, working with contractors, Spectrum Lakeland, and the health department. But Lex Wyman and his crew put that together.
Yeah, they've done a lot of work on it, I know, from what you were telling me the other day. I hope everybody can go and access that and can give the link to people in your districts. And that the media will also access it because it gives a more complete picture than you would get if you simply saw new cases and how many people have died. Being able to see how many of those new cases require hospitalization is helpful because you'll see the number of new cases rise, the number of hospitalizations is not going to rise like that. And among the people who get sick, not everybody has to go to the hospital. Those who go to the hospital don't necessarily have to be in the ICU, And I think we have a total of 4 individuals, 3 or 4, who are using ventilators. So there's some good news on that dashboard. If people go to it and read it, I think it will provide some encouragement as we're heading into the days and weeks ahead, that Berrien County at least is well positioned to get back up and running, albeit in a way that is safe, and recognizing that we need to continue to provide special safeguards for the elderly population, because this is a disease that is primarily going to get people who are over 60, and especially people over 60 with those pre-existing health conditions, heart disease, hypertension, obesity, diabetes, breathing problems. And if you're under 50 and you get really sick, it's because you have one or more of those pre-existing medical conditions. So the good news is most people who are exposed to it are going to weather it and get through it and be okay. But we have to continue looking out for the older citizens, and even as we reopen businesses, those folks will continue to need some special care and attention. With that, if we're ready to move forward, we have a break
Matt?
for public. Yes, sir.
Can they send us a link to the dashboard?
Yes, you'll have it very soon, before the next hour, hopefully. And I think that's going to be on our website soon. I know it's the health department's right now, but I think we're going to be getting it on berriencounty.org also. Anybody else? All right, public comments regarding resolutions. Thanks, Dan. We'll need to allow a little bit of a lag time in case somebody wants to submit a comment. So I'm guessing we'll need to wait a couple minutes.
Actually, I've been submitting questions in the chat box on our YouTube live of the meeting, and have been asking if we had any public comments about the resolutions that were going to be voted on today. I do have a comment from Tony Benhart of Sodas Township. The one regarding the road department and hiring the engineering firm needs to be denied. We have a road engineer and a department, let them do their work. And I'm just going to wait just a second here and see if we have any other ones.
Was Mr. Benhart referring to 4246?
It's an edge the edge resolution.
Oh, okay, 4243. All right.
All right, seeing no other questions, we were going to close the public, the comments about resolutions.
Right.
And I will remind everybody there's an opportunity for public comments again at the end.
Yes, general comments at the end of the meeting. We'll provide for that for anybody who's tuning in. All right, the consent calendar includes an added resolution 4243 to approve the requisition for Whiteman and Associates. Before we have any discussion,
Mr. Chairman.
Yes, ma'am.
Mamie Yarbrough, Finance Committee Chairperson. I would like, what can you put our pictures back on this of the members?
Pardon me?
Can the members' pictures be put back on the screen? I would like to make a motion. I believe I want to make 2 motions. The first motion I want to make is okay. I would like to
Couldn't
make.
hear. Stand by. Mamie, what was your first motion again?
My first motion is I would like to make a motion to add resolution B2004243 to our agenda for 4/30/2020. Should I read it again?
No, so do you want to add that resolution to the consent calendar?
No, I want it to be separate. Is that what you're getting ready to work on, just that?
Yes, so you want to not include 4243 in the consent calendar.
It's
Is
already,
that correct?
right, it's already as an added motion. And I believe that I need to make a motion to get it, the approval of the other members to add it.
No, you don't, actually. If any board member can pull a resolution from the consent calendar and have it dealt with and voted on separately, is that what you're asking to do?
Yes, and it already shows on the agenda that I asked that, and it is separate.
Okay. All right, well, the consent calendar will not include the resolution ending in 4243. What is your second motion?
My second motion, then before we have the discussion, is that the the resolution B2004243 dated April 30th, 2020, to approve the requisition for Whiteman Associates in the amount of $421,300 for construction services of Red Arrow Highway and Union Pier intersection be added. And it is to the, be a motion for us to vote on. And it's bid number 2020-051. So I just wanted it to be clear what it was and to put it in two motions.
All right, let me make sure I understand. Are you wanting to have a separate vote on resolution 4243
Yes.
and not included in the consent calendar?
No, and it is not included.
Okay, all right, very good. Well, then what we're going to do first is we'll deal with the consent calendar without the resolution 4243, and on the agenda above that resolution where it says added resolution, it also references Finance Committee discussion.
Yes.
Road requisition. So let's get through the consent calendar and then we'll get to that next item, okay?
Thank you very much. And what I would like to ask you, Mr. Chairman, last week we voted on a requisition and I asked if there was any Kalen construction bills on there, and in there it said there were not, but there was one. So I would like to abstain on that bill or on the whole sheet, however I need to do. As I've told you all, my son works for Kalen Construction, and when that comes up, I want to abstain.
Okay. To my knowledge, there was no vote last week on the requisition list that would affect resolution 4243.
Right.
So with that, is there a motion to approve the consent calendar, understanding the consent calendar does not include the resolution ending in 4243?
Commissioner Hugel will make that motion.
Thank you.
What's that?
Hugo makes the motion to approve the consent calendar. Is there support?
Commissioner Harrison seconds the motion.
Volrath beat you to it. Thanks. So moved by Hugo, supported by Volrath. Any discussion?
Mr. Chairman, this is Commissioner Scott. I have a question on P2004230. I guess I'm looking for some clarification. That is just a renewal of what is existing. Is that correct?
Yes. That's
because
for all of those.
There was talk a few months ago that even though it's the board can do this to raise that millage, and I just wanted to make sure that that was a renewal and not a raise.
Correct.
Thank you. My only question.
Any other questions? By way of underscoring the discussion when Nikki was giving us a briefing, and since Captain Adams is here now, the resolution ending in 4233 should not be interpreted as an indication that anything has gotten worse in terms of our ability to deal with the coronavirus in Berrien County. Rather, if you look at our overall numbers in terms of hospitalizations and people who've become seriously ill, things are looking better. But we still need to have that extension of the statutory civil immunity that only comes while we have a declaration of emergency in place. And that statute provides that no one can be sued for any action taken in furtherance of the declaration that this board makes for any property loss or personal injury that may have incidentally resulted from those official actions taken during a declaration of emergency. And we extend that protective wing to cover volunteers who are working under our general supervision and control, and would even have extended, if we needed to, lease some additional space for patients at off-site locations. So, and the other aspect of it, and Captain Adams is here if anyone wants him to comment, is FEMA. We still want to be able to get stuff from FEMA or through FEMA. And they look, there's a threshold inquiry, and that is, have you declared a local state of emergency? If you have, then you become eligible for the stuff, whether it's personal protection equipment or 55-gallon drums of hand sanitizer, disinfectant wipes, you name it. There's a long list of things that we are eligible for because we have that declaration in place. If we dropped it at the end of the day, today, we would no longer have that eligibility. So if anyone were to ask you, well, why did you extend the declaration of emergency for Berrien County if the dashboard numbers show that there's a light at the end of the tunnel? Well, you tell them those two things. We wanted to continue to have the shield from civil immunity, and we also want to continue to receive products through FEMA directly or through grants that FEMA approves. So with that, if there are no other questions or comments, the clerk will call the roll on the consent calendar.
Yarborough.
Yes.
Harrison.
Yes.
Hinkleman.
Yes.
Scott.
Yes.
Chickering.
Yes.
Ballrat.
Yes.
Freeling.
Yes.
Curran.
Yes.
Hugo.
Yes.
Majerick.
Yes.
Leaks.
Yes.
Elliott.
Yes.
Mr. Chair, you have 12 yeas.
Consent calendar is approved. We now go to the Finance Committee discussion, which pertains to the added resolution ending in 4243. Chairperson Yarborough, do you want to commence that discussion?
Yes, thank you very much. What I would like to do, the motions are there, and under those motions, I would like to ask Jason Latham if he would make a presentation to us. Administrator Wolf let us know that he would come so that we can continue to have an understanding of what is going on, and to the full board, so that we will be ready to vote on this requisition. So is Jason Latham somewhere?
Yes, he's here.
Yep, I'm here. Can you hear me?
Thank you, yes.
I'm down in the corner. That's my hand waving.
Oh, thank you. Thank you so much. And I ask you to come however you like to, for however long, because this is important.
Yes, it's very important. I really appreciate the opportunity to come here and talk to you guys about this. I'll jump right in if that's okay. We're going to do kind of a tag team here. Annette's going to actually run the PowerPoint. So we're sharing our screen right now, so hopefully everybody can see that. So I'm going to jump right in. So here's what we're going to talk about is the bid process. So we'll basically go over what we've been doing here for the last 2 years. So since I came on board, this is pretty much the process. In essence, we put a packet together. It gets advertised. The finance committee receives the bids, the bid proposals, opens them up, reviews them, and then hands them over to us to make sure that we're able to confirm either a low bid or a quality a base bid. So we do that. I'd say a lot of our bids you guys see all the time, but the qualification base is something that they're far and few between. You don't see them that often. That's why I really appreciate this opportunity to jump in and go over that process one more time. So let me just talk about quality-based for just a second. The actual term qualification-based selection, or QBS, is something that it's a national standard. It's used all over the country. And certainly the ACEC, that's the American Council of Engineering Companies, they endorse this practice that we follow, which is great. That's where you want to be. You want the professionals to endorse what we're doing. And in essence, they're saying this process helps us ensure that we get the right qualification and experience for the service that we're looking for. And they basically say that really it's not low bid. It doesn't have anything to do with price. And that's the process that we follow at the Berrien County Road Department. So in essence, what we're talking about is the best quality, the best value. You're trying to reduce your liability. In essence, you're looking for the right professional to do the work for you. One of the analogies I was going to come up, just maybe this helps, hopefully it does. I don't know if anybody's ever been to the Mayo Clinic, but when you're at the Mayo Clinic, once they get you in there, they send you to every professional possible. Those are all doctors, and they're all proficient in what they do, but it's not necessarily the health doctor can help you out with an issue with your foot. So they'll bounce you around to where they need to, and it's based on their qualifications. So the nice thing is we're kind of doing the same thing here in our process. So what does that look like? Well, we have a score sheet internally, and this is how we score the proposals that we receive. And we talk about bid proposals. And when we look at those proposals, we have to make sure that the team that firm put together represents a team of professionals that can get the work done that we're asking for. The one thing I can say is when we ask for proposals, we're only asking for proposals from firms that are pre-qualified. So every firm that puts in a bid proposal for these services, for engineering services, those firms are absolutely 100% qualified to do the work because they pre-qualify. But when we ask for a proposal, we're saying, okay, we know your firm can do the work, but what team are you putting together on this job that can help us do the work? Give us some background. So here's a couple examples I'll run through. We'll start with Marquette Woods. That's a proposal we asked for last summer. It was for design engineering services. There was some bridge work, some road work, and some culvert work with guardrail. And we just asked for a proposal. We had these 4 firms that were all qualified to do the work, 100%, all 4 of those firms could do it. But when they put together that proposal, they said, here's the team that we're going to send to you to do that work. And the team in this particular case, we scored them, and Avamar scored the highest. So that was our recommendation to the board. And I think either myself or Bill maybe came to the finance committee and just let you guys know that. Or in this case, we might have just put it in the rec as this was scored, and the team with the highest score is the one the road department would like to move forward. And typically that process is on a Tuesday is where we hand you that. We may have had the proposals for 1 week, we may have had the proposals for a month, depending on how quickly we can get to them and score them. But usually what we do is we send all that to Annette on Tuesday, and if it's a high profile project, Bill will request that I attend the finance committee meeting and actually explain it. Or if it's not super high profile, it'll just be in as part of the rec. So with this Marquette Woods, here's the example. We did not take the price, the actual bid, into consideration when we scored it. We looked at that score sheet that I showed previous, and looked at the team that each one of those firms put together, and we rated them. So obviously there's a case where we didn't go with the high, we didn't go with the low. We went with Avamar, which was kind of a little bit on the high side, but certainly in between the high and the low. So the next example would be the actual design services for Union Pier at Red Arrow. And this too was done last year. And again, we wanted proposals for engineering firms that are pre-qualified in design services for total reconstruct, streetscape, a lot of elements, a lot of public outreach. You know, that's what we were looking for. And we scored them. Whiteman scored the highest, and that was our recommendation. And in that case, we can show you that they weren't the highest, they weren't the lowest. That's kind of maybe a theme here. When we look at design services, we're only looking at the proposal that was sent to us and the team that firm said will be doing the work. And in this case, like I said, the firm we chose wasn't necessarily the low or the high. But in this case, I was asked to attend the finance committee meeting, and I think I am doing what I'm doing right now, which is reviewing how we scored them and why we selected them. And again, that was probably sent to you on a Tuesday, saying Jason's going to come here this Thursday and request that White be the selected firm. So that brings us to the project that we're talking about right now, which is the construction services for that project. And again, we received those bids 2 weeks ago, Thursday. They were hand-delivered to us by 1 o'clock. Our team reviewed them, scored them. We met Friday morning to kind of go over and compare notes and get a recommendation together. And then we called the firms and said, we've scored the firms and our recommendation is going to be Whiteman. So Avamars were made aware of that, and OHM were made aware of that on that Friday. So we didn't have a chance. I guess if you look at the actual pricing of that, again, we weren't the high, we weren't the low. Whiteman was in the middle. But the price was not taken into consideration when we scored these proposals, because in qualification-based selection, you don't use price. I can tell you that when MDOT does this process, they actually don't ask for a price, so you don't know, nobody knows what the price actually is. You just score, you select the highest, then you open up what their price bid was, and then you negotiate from there. But that's a process that we don't use here at the county. It's a little bit different, it's a little probably outside what you guys would be used to seeing, but I can tell you that the process that we are following, even though we do ask for a bid proposal and we get a price, I've been doing this for 25 years, so I'm very, very familiar with how to score qualification-based proposals. But we are following some similar areas. There's some counties that do it just like us. City of Portage does it very similar to us. So we're not outside of any process that most firms, well, any pre-qualified firm would be familiar with. So the next slide is really just to drive that point home, that when we look at proposals, we're evaluating a team. The team that firm put together to say, here's who we want to do the work for you, Berry County Road Department. We're not evaluating the firm, it's just the team. So let's jump into that real quick. This is the actual, no, you can back up, you're doing good.
There you go.
So go one more. One more.
Went the wrong way, sorry.
Yeah, that's okay. So the actual score sheet, I'm going to show you the overall score sheet first, which might be like around slide 13.
Sorry.
Oh, so the next. Well, I'll just keep talking. So the overall score sheet shows each category that we look at. And those categories are very familiar, like I said, with all these engineering firms in the state that are pre-qualified with NDOT. And once we tally up those numbers, you notice that Whiteman scored a 76, Adam Marsh was a 69.5, and that's out of 80. And once we got those scores and took a look at them, we wanted to come to you guys and basically just tell you that. We just didn't get a chance to make it to you on Tuesday to say that I would show up at the Thursday meeting to explain our selected firm. I think we were asked that first thing Monday morning to start preparing for that Thursday meeting last week. So that's what we did. And it was a nice, robust discussion, which is great, and that kind of tabled it to this week so I could put together this presentation so I can give you guys the overall update. So just to backtrack, Annette's got anything else
Trying to
to
get you
run?
there, I'm trying to get you back to where you were.
Maybe around slide 13, let's look, I think.
There we go, that one.
Yeah.
I'm not able to go back to the slideshow, but at least they can see the.
Okay, so
Yeah.
that's the overall score. So you notice how there's several categories that we looked at when we're scoring. So if we jump into the next one, I just want to highlight two of them, two categories. Yes, exactly. So this would be qualification of the team. So Avamar scored a 9, Whiteman scored a 10. I guess I should say one more thing first. When we called the consulting firms to let them know that we've scored them and who our recommendation was, obviously Whiteman said, great, we're willing to jump right in whenever you guys are ready. The other two firms were like, okay, well, is there anything we can do better? And what we told both of those firms is whenever you want, if you want to come in and debrief, we'll go over your proposal, we'll go over how we score, and we will tell you where you didn't hit the mark and where you did hit the mark. So we make that offer every time that we have a request for proposals. For any firm that's never won that job, we've told them, come on in and we'll talk to you. So for example, last summer, Avamarsh did not get the design services for this project and they wanted a debrief. So we met with one of the Avamarsh staff members and we went through their proposal and we let them know areas where they could make their proposal a little bit better, or some information they should add to it that we're looking for. So that debrief is really important, and I think most consultants take you up on that. Not always. Sometimes they just want it over the phone. And OHM on that Friday just asked over can we do it real quick over the phone, just because we want that feedback, and they were happy to get that feedback over the phone. So the next slide here, which we're going to be talking about, the actual qualification of the team. Here's a little rubric we put together as we were scoring, just to help show some of the aspects that we scored. So here we are trying to look at each proposal that the firm said, here's my key staff, and here's the key staff roles and responsibilities for this job. Well, the key staff, obviously for Whiteman, jumps off the page in terms of years of service. You know, the 2 professional licensed engineers, several years of experience that they're willing to put on the team. They have their inspector, 32 years of experience, very well versed. That's the team they put together. And then the team that Whiteman put together, it was only 1 licensed engineer, very good engineer, but only 1 with a deputy that's not licensed, and then an inspector with 5 years of experience. That, you know, probably not the number of years that you'd like to see in terms of a project of this level. But still, a good team, very qualified. That's why they got scored a 9 out of 10. The next piece that we looked at was actually like the team experience. Okay, so we had the individual qualifications, and now what's the experience? Give us some examples of what you guys have worked on in the past that would make us want to hire you. So again, this is the team experience. So those people, the key roles, key responsibilities, what they put in their proposal, Whiteman said, here's 5 streetscape projects, so complex. They have, whether it's lighting, trails, concrete pavers, working with business owners in terms of actually closing their driveway or moving parking, all those things that streetscapes are really interactive with the businesses. Here's 5 examples of major projects we've worked on, and not we as a firm, but those people, the key people, the people with 30 years and 32 years of experience. Here's their specific projects they worked on. And then when I got to the Abermarsh proposal, they didn't have any examples of any streetscape projects that the team, again, the people with the licensed engineering or the inspectors, have worked on. So when I'm scoring a proposal and I see a team that does not have that experience with the work that we need, then that's a little bit of a red flag. So that's where they scored a 7 out of 10 as opposed to the 9.5 out of 10 that Whiteman scored. So here we have, you know, almost a $4 million project in Union Pier. It's probably one of the more critical projects we've worked on in terms of scope. And I want to make sure that I have the most qualified team helping to do that construction engineering and inspection. I can tell you that I just got an email this morning from MDOT. MDOT is still reviewing and going over paperwork from our Red Arrow overlay project from 2 years ago over there by Warren Dunes. So I can't stress enough how detailed and meticulous you need to be when you're reviewing and inspecting projects that have federal aid tied to it. There's probably 1, 2, 3, 4, 5 forms that need to be filled out every single day. And here we are 2 years later from that Red Arrow, and MDOT saying, you know, on September 2nd at 10 o'clock, you guys wrote this on this piece of paper, and I don't see the signature here. What happened? And if we can't find it, if we don't have that documentation, then they can take their money back and we have to pay for that piece. So we could be on the hook for $50,000, $5,000, $500,000 if there's one piece of paper missing. It's amazing the level of documentation that's required. So I want 100% best qualified people with that experience that know how to do it, because we're going to be pouring through this paperwork 2 years from now, and if I know I have people that have done it before, that are very well qualified, my level of my expectation is going to be met, I'm sure, but my level of confidence is going to be really high, and that's why it's really important to go qualification based, because I need those qualities and that qualification to make sure that we're going to hit it, because if we don't, we'll find out 2 years from now, guess what, we don't get any of the federal money for this project, we got to pay it all back. So really, really critical that we pick the right team with the right experience. So our recommendation is to award the contract to Whiteman, and it's because that's the most qualified team. Has nothing to do with the firm. All the firms that bid are great firms, but the team that we scored, the team that firm said they're going to send to us to help us work on it, that's the most qualified team, and therefore it's the best value, because you know that you're going to get that team's best work, and that we're going to get it done correctly. So it's in essence, it's just ensuring that that phase of the project is administered by the most experienced team. And I'm going to keep saying team, not firm, because all of these firms are pre-qualified. All these firms are professional firms that we need to work with and we will work with in the future. But in this case, this one particular example and proposal, Whiteman put the best team together, and I think that it is in the county's best interest to make sure that that's the team we move forward with. So I tried to go as fast as I could. Hopefully that made sense.
Thank you. Thank you so much, Director Latham. I'd like to ask, or do you want to ask Chairman if there are any questions or,
Sure. Does anyone have any questions of Jason?
I do. This is Commissioner Meeks.
Yes, sir.
Can you hear me?
Yep, we can hear you.
Okay, well, I want to say this is, why don't we do the pre-qualification first before we put the bids out? Should be everybody putting.
Right, so we accept bids from pre-qualified firms. So that's kind of generally, I don't think we've ever gotten anybody that wasn't pre-qualified trying to bid on a project. But if they've gone through that process with MDOT, and it's MDOT's pre-qualification process that we're looking for firms that have gone through that process, that levels the playing field in my mind. That means we're getting professional firms that are putting proposals together.
But what you're saying, this rating that you're using now is better than what the state used for pre-qual.
Yep, that is the exact form that I used 15 years ago at MDOT that spelled out the team experience, the team qualifications, past history, QA, QC, each one of those items. And that's what every firm knows, that they need to be put their best foot forward when they put a proposal together, because those are the elements that are always scored.
Well, it kind of sounds like they need to have a point system on this where each at start where everybody knows where everybody's. But this right here, it get down the end. I mean, yes, there's ways to justify it. But when you justify it at the end, I don't really think that's fair for the contractor to submit the bid.
Well, I appreciate that thought for sure. And we do have it is subjective. When you're scoring, I think some of what I was trying to show you were non-subjective pieces of the proposals. How many licensed engineers? How many years of experience? How many projects have they worked on? That's not subjective. It's just right out of their proposal. So that was an easy first blush. But then in terms of reading the proposal, how easy is it to read? Are there grammatical mistakes or sentence structure mistakes, or the way they explain something? They might just put, I worked on this project. Well, that's not a lot of detail. But you kind of know what it means because it's the project they worked on. So it is subjective when we score it, but that's why there's at least 2, if not 3 of us scoring these, and then that's why we go over it to discuss it, and then we make a recommendation internally.
Well, what I'm saying, I think this process probably work better if it's done at first rather than at the end. It's just my take on it, Jason.
Okay, thank you.
Chairman? Mr. Chairman, Chickering here.
Yes, sir.
First of all, I'd just like to say that this is a very complicated issue, and this is a singularly inappropriate means of having a good discussion about this topic. But with that said, Jason, based on what you've said, and I heard the word subjective several times in your answer to Commissioner Meeks, your overall rating of these firms, which are all highly qualified, as you say, was within 1 or 2 points overall. And yet you chose to go for the vendor that was $80,000 more than the other. So are we to tell our taxpayers that 1 or 2 points out of 100 is worth $80,000 to them?
Well, so I say absolutely yes. You're supposed to tell them that because it's qualification based. What we reviewed in that proposal would be, are you willing to let a firm that has had no experience whatsoever on streetscapes be responsible for $4 million, where they make a mistake and now we're in the whole $4 million or $2 million or $1 million or 500,000? It's that simple. I mean, if that team that they put together did not have streetscape experience, so if they make a mistake, they could put a business could go out of business because they don't have the team with that experience.
You said they were pre-qualified and streetscapes were one of the qualifications. And, you know, Jason, it doesn't hold water. Abinmarsh has been doing this kind of work as long as Whiteman.
So that's a really that's a really good point. You're right. They've all been doing it. They're all pre-qualified, and they all know. Abinmarsh knows 100% that if they're going to put a team together and they want to win this, they have to put a team together that's experienced in doing this work. They put a team together and a proposal that was not experienced. So the whole firm is not doing the work. The only people doing the work are the people on this proposal. And the people on this proposal have not done streetscape work. So I don't think I want to put, when I'm comparing the Whiteman team versus Abinmarsh team, and it's just this one proposal, I want the A team with all the experience to make sure it's done right. I don't want the B team where they're learning how to do it and make mistakes or figure things out on my dollar, because it means that I'm going to have to pay for it out of my road budget if it's not done correctly the first time.
Other questions, comments?
Commissioner Scott, Jason?
Yeah.
I was privy to the finance meeting last week when we discussed this. And I'd like to make some points, if I could, to make sure that I'm correct in what I heard and what I understood about last week. On page 3 of your proposal that you sent to us on the explanation, that is the Berrien County Road Department Proposal Services Selection Scoring Guide. And I specifically asked you if this was for this construction project or if this was a standard. And you said it was a standard that you use for all projects. My question to you is, I requested from our administrator the RFP for this project. It was sent to me and it said the following items are to be added to the original proposal request: construction staking, handle all public outreach, provide and maintain information website for construction updates, consultant hours should be estimated for minimal county involvement. So am I now to understand from you that each contractor with their bid gets a copy of page 3, which are your proposed services and selective scoring?
So we don't send our score sheets out directly. It's like I said, I think it's this off the MDOT's website, MDOT score sheet. This doesn't. I mean, like I said, it's the scoring is subjective, but the score sheet itself, when we're reviewing it, that's the basis that we go by, because that's the basic information that all firms use when they put together their pre-qualification package to be pre-qualified in this. this arena. They have to have experience, they have to have licensures, they have to have quality assurance. All those topics are part of what goes into a proposal. So it's pretty much common knowledge. That's the information that we're looking for. And that's the same information that I debriefed I debriefed Avonmarsh last summer when they didn't get the one job. I went through each one of those, so they're very familiar with it. Every firm in the state is very, very familiar with that scoring procedure and proposals.
So what you're telling me is they did not get this specific sheet. The only time they get this specific sheet was when they pre-qualified to bid. Correct?
So what happens is you put out, so the county puts out, here's what we want a proposal. And then sometimes firms will call up and say, well, do you want this, or do you want more work, or do you want other things? Well, then we'll do an addendum, and that goes out for everyone to go, oh, here's additional information that you should include in your proposal.
Okay.
So that addendum, everybody should have gotten, and that should have been part of their proposal.
All right. Now, my kind of one of my last things on this is, as a county commissioner, every one of us is responsible for the public integrity, and we're also responsible for the fiscal management of the county fund. But one of the things that is the most important thing, Jason, is we have to have a process. Okay? Yep. And when the process is broken, we can't move forward with the results of the process. We need to fix the process. In your papers that you sent and in your slide presentation, you showed that the Marquette Woods Road widening project was awarded to Avonmarsh, and they were not the lowest. Okay? That is correct. Is that correct?
Yep.
That was done on July of 2019. Okay? I want you to understand, and the other commissioners to understand, we have to follow a process. When you are going to take a higher bidder rather than the lowest bid, you're supposed to come back to finance and let us know why. I think that's kind of already been established. Okay?
And we have. I think we have almost every time, if not at least sent the recommendation and through Annette.
Okay. I would just like to make this point. From 7/11/19 on the Marquette Woods Road until present talking to you right now, this is not, the Marquette Roads was not in any minutes of any finance meeting up till this very minute. What I'm trying to say is this is a process. And if we're going to violate the process, then why even have a process? We are responsible for this process, and that's the most important thing that's going on here. And when this was brought up, it was brought up prior to the agenda going out for the finance meeting last Thursday.
Correct.
Because it was brought to a commissioner's attention. Wasn't my attention, but it was brought to another commissioner's attention. So that's why we're discussing this. But I want the board to know we must follow our process. And just saying that, well, we're going to give this to Whiteman because we followed everything through and we gave it to Avonmarsh on the Marquette Woods. That may be, but you never came back. You never came back. Nobody ever came back, because if it's not in the minutes and the minutes were approved, it did not happen. And that's what I'm talking about. This is process.
So I hear what you're saying, 100%. I think that might, I'll double check with Annette. We'll see where that one, if you didn't find it, then maybe it's not there. But I guarantee you, we've come back every single time. Maybe we missed the Marquette Woods, but when you guys open the bids, the process is, you are saying, it says right in there, we say, Berrien County Road Department, please go low bid or best bid, and we're referring it to you for your decision. And then what we do is we make a decision, and we make a decision based on my 25 years of experience and the industry standard. I can guarantee you, without a doubt, we follow the right process when it comes to the selection. The process you're referring to is not the selection process. It's the follow-up process.
Correct.
In which case,
that's the one I'm concerned with the most, because that.
So the one thing is, if Adam Marsh wouldn't have called people over the weekend, you would have gotten this in your packet on a Tuesday. Jason is going to come to your meeting, and he's going to do everything I just did now. Probably not in the same level of detail, but certainly the same level of detail I did on the design side. And then certainly what we did when we did asset management, because asset management, Adam Marsh was 50,000, Whiteman I think was 35,000. And the team that Adam Marsh put together for asset management had so much more experience and was better qualified to help the road department develop an asset management plan. The team that Whiteman put together didn't have that experience. So I came to you and Bill to explain that. And that's why it goes back to proposal and who the team is and who's doing the work. It's not the firm, it's the team that's on paper that I'm scoring. Because what you're talking about, Ezra, is integrity. And our integrity as a department, our integrity as an industry in terms of civil engineering is, I have a process, I've been following it for 25 years. And that's the process I followed here. And every single firm knows it, understands it, and their very livelihood as a firm depends on it. So I guarantee you I followed the correct process when it comes to scoring and recommendation. What ended up happening is we got a complaint from the firm that didn't win. You heard that complaint prior to us giving it to you on that Tuesday and then coming to the meeting on Thursday. So that we could try to figure out how to better get that information to you and better explain it. But it's not going to change the scoring process. It's not going to change the QBS, and it's not going to change the ACEC and the national standards, which we are following and did follow.
Any other questions or comments? And bear in mind when you're talking and someone here is talking, you need to wait a second or two because there's a lag in the audio transmission, unlike when we're sitting in the same room. So with that, any other questions, comments, concerns?
Mr. Chairman, oh, please go
Yes,
ahead.
ma'am.
Commissioner Freeling, go ahead.
Terry?
I'd like to wait.
So I just wanted to go back to what Commissioner Scott was talking about in the process. It sounds like there might be a misstep happening here with regards to getting information back to the committee from those departments. There is a vendor selected that could be higher, or just the selection is different. But for me, you know, Jason, you talked about that MDOT is reviewing what we did on Red Arrow Highway there in Bridgman, and that it is incredibly detailed and meticulous with regards to the paperwork, making sure that T's are crossed, I's are dotted. And as a board, I feel like this process, while I don't think we're faulting the scoring process or any of that, Jason, or questioning your experience, I think that it is our due diligence as a board to make sure that the integrity of this board and the decisions that we make for public trust is on the up and up. And we have to follow the process. And if that means that we need to readdress this, then so be it. I feel like there was something that got missed in this, and it's our job to review it to make certain that everybody is comfortable with how we move forward. That's my comment, Chair. Thank you.
Never mind. I didn't notice the red light was on. Mamie, you were going to say something?
Yes, I thank you, Jason, for the information you brought to us. But there are a couple of things that our board needs to know. We have a motion and it's laborious. We kind of laugh about it, but we read every word of it. And when this came up and we started talking, I think there are three interpretations of what this motion means. We do not have this motion that we use it for anything else other than the road department. And it's a motion that we created, the administrator, the road department, the finance committee, and hope that it covered what we needed to cover. And I must share it with the board. I want you to hear this. It says the motion. When we open a bid, it says motion to refer bids to the department with your approval to move forward with the lowest bidder if they met specifications and requirements. However, recognizing that the best qualified bid can move forward. In addition, we authorize the county administrator to execute the subsequent contract associated with this bid and any contract modifications up to $5,000. I think at first we talked about 10,000, but that was too high. So when a bid comes in and the lowest is maybe not what the road department may want to use or qualify, it goes to the administrator and he can go up to 5,000 more. No one has come to us and said, we're going to use this bid, we're going to do that. Last year, the design work was bidded out and Whiteman received that bid and it was $41,000 more than the lowest bid. Then this year, when this came up, we found out through people calling us saying that this is enough. We want somebody else to know and see what is going on. This $80,000, that means $121,000 if we approve this today, over what it could have been. I understand about the team and about who does the work, and we understood it when we made this motion. So we as a board, when we, as a finance committee, when we open those bids are opened and it's the lowest bid and it's, as you said, qualified companies, we assume it was going to the lowest bidder, and that is not so. It makes me wonder what else? What else do we not know? And this bid needs to be worked on because as we've been working this past 2 or 3 weeks, we've had 3 interpretations of what this bid says. And when you take it and you're working it and using it to do your business, you're doing something completely different from what the other pots think. So there is a problem here, and $121,000 to me cannot be ignored. And I want things to work. I don't want to hold this up. And I just want the other board members to know this motion that we worked on that we thought would cover what our needs were. And you continue to say that you come back. We do not know when you use other bids. So one of the things we're going to put in, and we're going to work on it, is that we are notified of who gets the bid. If you were going to, by Tuesday, say to the finance committee, we're going to come and talk to you on Thursday, you'd already decided you were going to use Whiteman. That's what Abernathy called it.
Of course we have.
Whiteman. So it's already done, and that cannot be. We need to know. That's what I want to say.
Okay, the administrator has a comment.
Yes, the unusual circumstance of this occasion where we have a bidder who gets a phone call and explained that he did not get that, even though he had the job, even though he's a low bidder, and then begins a political motion to have a staff recommendation overturned. is very, very unique. I can't say that I've ever dealt with it in 15 years. However, in this case, he came into the process before Jason had ever even had an opportunity to brief me. So Jason takes those bids, he opens them up, he and his team review them, they make a recommendation, and then if it is not the low bidder, they come back to finance. And I've heard repeated allusions that this thing is broken, that the process is broken. And we can't think of a single time that we took someone who was not the low bidder and did not come back to finance, but I hear that repeatedly. But Commissioner, if this process is broken, which we created to satisfy the needs of the Finance Committee, and you're the chair of the Finance Committee and you want to open that process up for review, that's fine. But we've been operating under this for 2 years. And now this is the first time I've heard these type of objections, and they tie back to a vendor who feels that he was slighted.
And the thing is that we have never been notified that Team A got the bid, Team B got the bid. Oh, we need to come back and ask for a higher rate because we need this one more money. In our minute, in our memory, no one has ever told us that.
Commissioner, what is it that you pulled from the agenda?
What?
You pulled an item last week from the agenda. What was that item you pulled?
This bill right here.
Exactly. You were being asked to formally move on a requisition approving the decision to go with Whiteman on this particular contract.
Right,
you pulled it. So don't say you don't see him come back. That's where this all came from.
That's where this came from because we were called and said they're going with the higher bid, which is $81,000. I assumed they were going with the lowest bid. That's what I assumed. And when I called you, Administrator, I called you on Monday. I wanted to call you Sunday. It was suggested that I wait and not disturb you. So I called you Monday, and you didn't know who had the bid. But somehow they were able to tell Avonmarsh that Whiteman had the bid. So I just
nobody had the bid until you guys approved it.
I beg your pardon. I'm sorry. I couldn't hear you.
Sorry, I didn't mean to interrupt, but I think nobody has the bid until you guys approve it. I don't want anybody to think that the road department has that authority. All we do is make a recommendation. You guys open the bid, you say, on construction projects, we go with the low bid 99 out of 100 times, because we have to. On qualification based, you say go low bid or best bid. Well, we follow quality QBS, we select the best firm based on qualification based selection and scoring, and then we come back to you and say that's what we're going to do. We've come back to you every single time.
You have not.
I've personally come back to and updated everybody in person. I know Bill has too. I think the one Ez was playing about Marquette Woods that Avonmarsh was $20,000, $30,000 to $40,000 more than the low bid. I don't know. I don't think I came back personally, but it came in as a rec with we scored it, and I have the scores, and here's our recommendation. So we're following that process. It's just not. I guess it's just so far and few between. We forget, maybe. I don't know, but we can certainly work on that. I'd be more than happy to.
And with this motion, Jason, we were trying to work and make it where you didn't have to come back every time and say, can we have a little more money? This is what we hope this motion covered, because it said understanding that it may not be the best bid because of the price. We wanted to work with that. So
yeah, it does work. It actually does work.
We're going to work on that. But I want the whole board to know what is going on, and for them not to think that we're not trying to, or that we're not doing our duty and watching and doing what is the best for the land. That is
great. Thank you.
Mac, is it all right if I say something quickly?
Yes, sir.
All right, Mac, I probably sounds as though I'm kind of an outlier here, but I was anxiously awaiting this presentation because I wanted to listen and hear, and I feel very comfortable that after listening to Jason speak, that he's trying to do the best thing for the community, to do the best thing for the roads. He's trying to make the best selection that he and his team, his engineers, Kevin and the like, can make. So I'm confident that, that they've thoroughly vetted this, and I feel comfortable that, while it's not, we've had in the past where we've allowed a higher bid to be selected because it better met our specs. And so I think that Jason has vetted it well enough so that I feel confident that they're trying to do the best for the community. So, and I, sounds contrary to what I'm hearing here at this point in time, but I feel comfortable with it. I'm sorry that there's that much disparity, but confident to take all that into account. So, thank you.
Thank you, John. Bob, you're the fourth person on finance. Did you have anything to share?
I said most of my piece last week. I would be concerned with competitors supervising each other's projects because in my experience is they have professional differences and then they fight over them, and the owner ends up paying more. And so I suggested, my question last week was, why was this project split into two pieces? And I think I heard Jason say, well, that just kind of, he thought that's the way to do it. So I have concerns that you would have Avonmar supervising Whiteman's design and then how to go about doing it. So that would be one thing. And the other is I think we can clean up a little bit of the language in our resolution and clean up the process to make sure that we are aware of when we're not going with the low bidder and the reasons for that, which we have heard, on a pretty regular basis. So this is just a little bit bigger cost than I think we were experienced in not going with the low bidder. And I can see the reason for it because it is a fair amount of money, but I'm comfortable moving forward with the proposal from the road department.
Anyone else have anything to share?
Commissioner Scott, can I make one other comment that came up? Our administrator said that this would not have been the way it went had this Jason then been allowed to come to the finance department to explain this, is what I understood him to say. And I guess I have a little bit of a problem with that, because if that was the case, then there was absolutely no reason to have the requisition out there, because all I know is that when we get the requisitions and we see this, unless we had known something about it, we're going to approve the requisition. And that happens all the time. That you see that all the time. This just happened to be from a taxpayer, whether he was a competitor or not, was wondering and talking, from my understanding, to another commissioner about how much money this was. And it was $80,000 plus then later a $41,000 before. So I guess that's what I keep wanting to say about doing the process. If that was the case, that should not even have been on the requisition to pull last week. That should have been prior to. Thank you.
Commissioner, we usually put things out and then many times come to the parent committee and discuss that. We're trying to, particularly in this environment when we don't know the next time we're going to see the board, but it is routine to put a requisition out there and then come to the board. And it's not just road projects. Many times there are explanations given in the parent committee meeting for things that might be on the requisition list. Plus, if there's something on the requisition list that any of you have a question about, you're given it in advance so that you can ask it next. So you're making a comment like we were trying to slip something past you. My comment was we had another vendor stick his nose into an internal decision-making process before we'd ever come to a recommendation and come back to you to make that recommendation.
Do you have any recommendation today?
Yes, Mr. Chair, I just asked that the question be called.
Any other comments?
I'd like to make one. In Niles, we were doing 933 or 11th Street last year, and Keith Riley went on strike, and they started to finish the road with temporaries, and the management, I guess, wasn't doing it as well as it could have been. And I understand 80,000 is a lot of money, but also the management team that you put together is also important. And I think they totally botched up 933. When I first drove on it, you know, you get that nice feeling of a nice road. It's never been like that since they put it in. The roads don't even match up in the middle. If you go in the center line, you can fly either way from not matching. It was a pretty bad job, and I would hate to see that on Red Arrow Highway. That's my comment.
Anyone else?
I lost Commissioner Yarborough. I'm not sure where she went, but she's not in the meeting right now, just so you know.
All right. We're going to try to reconnect Commissioner Yarborough. We don't know what happened, but bear with us for a minute. You on speaker? You on speaker?
I could if I actually got Brayden. I was trying to get Brayden to call her because I know she fell off the list.
Just so that you know, out here in the country, my band, that says my bandwidth is very, very low at this point in time. And so I've lost you several times, but reconnected. So it's maybe the cloud conditions based on satellite pickup.
Okay. Well, hopefully we can get Mamie back on the screen soon, because we still have some other business to do. Stand by.
Commissioner, I have you on speaker.
How did I go out? Did everybody go out?
No, I think it's just you, but I'm going to put you by the chair so we can move ahead with business.
Yeah, but you knew I was off of it?
Yeah, we couldn't see you on the screen anymore.
Yeah.
So,
Cut me off.
well, we didn't pay our bill this month, and so they did that, I guess. I'm not sure.
Okay, here.
All right, so you haven't missed anything.
Okay, thank you.
We're at the point now where we need to wrap this up.
Okay.
I'm not providing legal advice to the board anymore, fortunately for the board, but we have a bid process that was undertaken under a set of rules or protocol. And I'm not sure how you unring that bell, so to speak. With this particular,
I can make a motion to pay the bill.
you can make a motion to pay the bill, and I think we all have a better understanding and appreciation for the process. And if we need to address anything in that process going forward, we can do so. We want all bidders to feel like we're giving them a fair shake. We also recognize that we have to avoid any appearance of impropriety, even when there's no impropriety that exists, as in this situation. So with that, and in light of all the comments, questions, concerns, is there a motion to approve the resolution B 2004243?
Yes, I would make that motion.
All right, that motion's made telephonically by Commissioner Yarbrough. Is there support?
Commissioner Scott will support.
Stand by 1 second, Ezra. What did you say, Mamie?
The roll will be called.
No, I'm waiting for a second to see if there's a second.
I know that, but I'm saying the roll will be called.
It will be in due course. Hold on. We'll get right to it. Is there a motion to is there a second to Commissioner Yarbrough's motion?
Commissioner Scott seconds for a roll call vote.
Okay, no, you're good.
Can Brayden put me back on this?
He's working on it. But for right now, Mamie, the motion that you made has been seconded by Ezra. Is there any further discussion? Hearing none, will the clerk please call the roll?
Yarborough.
No.
Harrison.
Yes.
Hinkleman.
Yes.
Scott.
No.
Chickering.
No.
Allred.
Yes.
Freeling.
No.
Curry.
Yes.
Hugel. Chris Hugel. Did we lose him?
No, he's,
Yes.
Majeric.
Yes.
Meeks.
No.
Elliott.
Yes.
Mr. Chair, you have 7 yeas, 5 nays.
I have a brief comment. I did not want this to fail going forward, and I knew if I voted against it, it probably would. A 6-6 vote means it does not pass. So I want the project to go forward. It's incumbent upon all of us to err on the side of caution going forward, make sure that there's full information sharing. I'm sensitive to Commissioner Harrison's remarks about competitors overviewing the work of competitors. So I'm trusting that we won't have an exercise like this again. I've gone 35 plus years without it. I'd like to go another 35 without it happening again, which means I would be 99 if we have to revisit this. So with that, that concludes our agenda resolutions. And
may I make a statement?
yes, ma'am.
Yes, this is Mimi Yarborough, Marion County Commissioner of Finance Chairperson. I want this project to work. I want to be included. Our committee needs to be included when the amount, and we will work, as I said, on this motion with all that it affects other departments and get it straightened out so that it will come back to us. To continue to say that you've come back and you've told us what you're doing, it has not happened, and it's got to stop. And I want this to be a success, and the most beautiful road, trail, whatever. This is my home. And so that's what I want to know. I have no animosity or did this with no other thing other than it's not right. And so I thank you. I thank you all for your time and the preparation that you did, Jason, and that all of you, the work that you've done with this. And it's not been easy. We've all worked on.
Well, thank you so much. I appreciate that.
Okay. Anyone else have anything before we've got the Personnel Committee, the pension rollovers, approvals, and then we have honorary resolutions coming from the Sheriff's Department. So if it's okay, we'll proceed to the Personnel Committee. Jason, thank you for coming.
Thank you.
Commissioner Chickering.
Thank you, Chairman. On a monthly basis, we approve changes to the payroll deduction and it is put back on contributions to our pensions, a benefit that our employees have. We approve those monthly. Since we have not been able to meet as a committee, we have to get the approval from the PHSC committee here in this meeting. So it will be a vote of the three members, Commissioners Vollrath, Freeling, and myself. So if I could have a motion from my fellow committee members.
Terry?
I will
or-
make that motion.
Okay.
Commissioner
Moved
Freeling.
Moved by Freeling. Did we lose Volrath?
Or
We can hear him. Okay. So you
Okay, all in
have a
favor?
motion and support?
Aye. Gary, aye.
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 Okay, so audibly, I could tell you did a roll call, and all three members of the committee have voted to approve it. So the refunds, rollovers are approved. I think that concludes our regular business. We can go to the honorary resolutions, and the administration committee is the sponsor of both of these honorary resolutions, I believe. Commissioner Curran, did you want to read one or sign them to be read, or how do you want to do it?
It would be my pleasure to read them into the record. Would you like me
Thank
to
you.
do that now?
Yes.
Resolution B 2004072 dated April 30th, 2020. Whereas Paul Granigan, born on January the 22nd, 1968, was a lifelong resident of Berrien County, and whereas Paul attended and graduated from St. Joseph High School and wore his Bears football and track uniform with pride. And whereas he furthered his education at Western Michigan University and graduated with a bachelor's in business administration, majoring in finance. And whereas he began his work for the citizens of Berrien County in 2007 as the financial services manager in the financial services department. And whereas in 2010, he became the business manager for the Berrien County Sheriff. And whereas Paul had an impressive work history while at Berrien County, and whereas more impressive was the mark he made on the community, as he was well known and well loved by many in Southwest Michigan, especially by his fellow Michigan State Spartan fans. And whereas Paul unexpectedly departed this world on Saturday, April 18th, 2020. And whereas with his outgoing nature and heart of gold, his life is to be celebrated and honored. Now, therefore, be it hereby resolved that the Berrien County Board of Commissioners recognizes the many years of exemplary service provided by Paul Granigan and extends their sincerest condolences to his loved ones, friends, and family alike. Be it further resolved that Paul Granigan's life, actions, and contributions reflect most favorably upon himself, his family, the Berrien County Sheriff's Office, the County of Berrien, the State of Michigan, and the United States of America. I don't believe we need to take any action on that because that was approved during the consent calendar, correct, Mr. Chairman?
Yes, that's correct. Did you want to do the second one for Damon Nichols as well?
I can. Resolution B 2004245. Whereas a lifelong resident of Berrien County, Damon Nichols, was born on February the 16th, 1975.
And whereas Damon Nichols attended and graduated from Benton Harbor High School and went on to obtain an associate's degree from college. And whereas while Damon didn't begin with Berrien County in 2010, prior to that, he was serving the citizens of Berrien County as a police dispatcher for Benton Harbor and a rural carrier for the United States Postal Service. And whereas in 2010, he became a public safety dispatcher with the county's 911 center. And whereas in the midst of what can be a job that has its chaotic moments, Damon made the work environment more picturesque and humorous, yet is described as having one of the calmest voices and demeanors that would inspire others, callers included, to also be calm. And whereas Damon lost his battle with cancer on Tuesday, April the 22nd, 2020, and whereas Damon embodied a dedication to his coworkers, friendships that were fed and cultivated, and an optimism even until the end. And whereas his life is to be celebrated and honored because those that knew him are better because of their association with him. Now therefore be it hereby resolved that the Berrien County Board of Commissioners recognizes the many years of exemplary service provided by Damon Nichols and extends their sincerest condolences to his family. Be it further resolved that Damon Nichols' life, actions, and contributions reflect most favorably upon himself, his family, the Southwest Michigan community, the County of Berrien, the State of Michigan, and the United States of America.
Thank you, Jim.
My pleasure.
Sheriff, do you have anything you wish to add?
Well, I would just add that Paul Granigan was a team player, worked very hard. We're going to sorely miss him. He was a great friend. Did so many things for the community when he wasn't working. Him and Buffy went on trips all over the world at times, you know, mostly every year during football season, he hung up his Sparty things all over the place. He was a big Michigan State fan, and the things that went on in our office between Michigan State, and Notre Dame, we all had a lot of fun with. But Paul was my business manager for 10 years and did an excellent job. You guys got to see him once a year when we came in and gave our budget proposals, and you know how dedicated he was, and how professional he was, and how well prepared he was. So we're going to miss him a lot. We're going to miss his work ethic, and we're going to miss his friendship.
Thank you. If it's all right, we'll forego commissioner reports. It's 1 o'clock. We still have public, or Bill, did you have anything you needed to add? We still need to take public comments on general matters, so stand by. We'll find out if anyone has submitted any comments.
You do have some comments that have already come in the chat box. So I just have to preface this by saying that you can only type in 200 words at a time, and then it makes you start back over. so that's part of the delay. So Tony Benhart with Sodus Township had made a comment that I would like to know how many people from the other cities and states become sick or brought the illness to others in Berrien County. And then referring to the road department resolution, is this a way to try to legally exclude firms due to the people working there rather than qualifications which are arbitrary as to people renewing the bids? Jason said last week he wished he had Brian back and would not have these issues. I would say hire an engineering firm for the year period by bid each year to do all engineering and design and be the engineer of record for the road department. If you remember, there was a huge issue with the 3 Oaks short drain, and I would check who did the work there as to the engineering. Jason, what about the bad choices in the engineering of Main Street and Benton Harbor? And now what do we do? What do we have here? And that was an NDOT project, and the road department does have a director with a biology degree, not an engineering degree, and I feel that is a huge issue. Those were the comments of Tony Benhart and Sodas Township.
Thank you.
And I'm still waiting for any others. I can see on the video that it's not cut up to a rag. That's what I'm watching. Okay, I have closed public comments.
Okay, thank you to those who submitted public comments. Other business, we have a night meeting next week, still on the calendar. I can't imagine that we're going to be open for business on the 7th of May. So let me ask if we have any pressing business that we know of today that needs to be dealt with on the 7th of May.
No.
I don't think so.
Thus far, all is quiet. That could change. Since it's already posted, we'll leave it posted and then we'll make a decision by Tuesday to cancel, or if you want, we can cancel it right now, and if something comes up, we can, by Tuesday, schedule a Zoom meeting like this that we would do at 10:30 a.m. instead of at 6 p.m. Which is your preference? Cancel now or wait?
This is Commissioner Scott. Mac, actually,
Yes.
we cannot have a meeting per the governor's directives because that's still social distancing and no gatherings till May 15th. So that has to be canceled.
Well, we could do one like this.
Right.
Instead.
But I mean, we have to cancel the night meeting that's scheduled.
Okay.
Yeah.
I didn't know if we would do a Zoom meeting in the evening instead, which I know would thrill you, Annette.
I would love that.
Yeah, and Sharon. So, all right, well, we'll cancel the meeting for the 7th. And if something comes up by Tuesday of next week, we'll make a decision if we need to do another one of these next Thursday morning. But for now, we're off for the 7th of May.
Mr. Chair,
Yes, ma'am.
just for the purpose of being aware, I believe the executive order for virtual meetings expires on May 12th. So next time we would be able to meet would be May 14th, which would then make that Open Meetings Act executive order exemption expired.
Okay, thank you. Hopefully the governor is mindful of that.
Certainly.
All right, well, any announcements, reminders?
Mac, I've got just under other business, I guess I'd like to find out, I know this meeting has run long, so, but if you can, I realize I missed last week. I looked through the minutes, I didn't see anything. I'm just curious as to how the committee on committee is doing as far as going through whether they're going through the resumes for the administrator position. I haven't heard a word from anybody about what is happening. You know, in the past, the normal protocol was people were going to be interviewed or talked to. that we would be given, that the entire board would be given the resumes and so that we could review those, and then the interview process would take place under the committee of committees. So I'm curious as to where we're at, that the date that Bill is leaving is fast approaching, and we are short corporate counsel as well, county counsel as well. And so, but I haven't heard a word from anybody as to how things are going. So at what point in time are there any people here that the committee on committees is thinking about interviewing or talking to, and do we need to review those resumes?
Okay, I'll give you a call after the meeting and get you up to speed.
Okay.
Anyone else have anything? Okay, we stand adjourned to a date to be determined.